Topping your news first tonight, the Guam Regional Medical City will soon be able to accept patients in its emergency room. The target date for opening emergency services is September 9th. In the meantime, doctors and nurses are working hard to meet that deadline. While the new Guam Regional Medical City Hospital officially opened its doors in July, their emergency services have not yet been available, but that will soon change. Hospital management confirmed a target opening date of September 9 at 7 a.m. We spoke with GRMC emergency room physician Dr. So Kobayashi about what patients can look forward to.
We have these trauma beds or this trauma room here for acute patients who are sicker. We have other rooms that have the ability to do negative isolation for patients we may suspect or we're concerned about an infectious disease that need to be isolated, such as tuberculosis or MERS. But in terms of the capacity of this emergency room, it's actually quite impressive and as good as any that I've seen. And I came from a large academic institution, so.
Dr. Kobayashi says that while they haven't been able to open up to the public, they have been busy training and working to be able to meet all the requirements for an emergency department.
So there's a lot of components that go into opening an emergency room. I mean, as you can imagine, from supplies, staffing of physicians, nurses, techs, as well as making sure all our policies and training are adequate, in order to make sure it's a very safe patient experience.
But even with large signs informing the public that their emergency department isn't open yet, there has been confusion in the community about GRMC's capabilities. Last month, the patient who visited the hospital's ER with breathing problems had to be taken by ambulance to the Guam Memorial Hospital because GRMC's ER was still closed. Dr. Kobayashi says even when their ER opens, there may still be some situations in which patients might have to be taken to GMH. And likewise, GMH may have to send some of its patients to GRMC for those very same reasons.
We'll always stabilize here in the emergency room, make sure a patient's safe before we decide the next steps. But there's always a possibility that the service might happen somewhere else on the island. Okay, for example, orthopedic surgery right now, but in the near future, hopefully that won't be the case. And likewise, it may be vice versa with GMH because we have a neurosurgeon on staff.
Where they might have to send a patient here.
Exactly.
Dr. Kobayashi emphasizes that GRMC will be and has been abiding by EMTALA, or federal law that prohibits a hospital from turning patients away.
We're going to abide by EMTALA. And, at some point in the near future, the hope is to be certified by the Joint Commission as well. So what that means is, essentially we'll be like any true ER in Guam or the mainland where we accept anybody who comes through the doors, regardless of ability to pay.
GRMC's emergency department will have an 11-bed capacity with room for more if necessary. Again, it's important to note that the hospital's emergency department is not yet open. Patients should continue to call 911 for emergencies.